Welcome to HIFIS and Coordinated Access Client Consent Training. The training is recommended for any staff who work directly with program participants or support staff who do. This training is designed to support the understanding of the HIFIS and Coordinated Access Client Consent Form and provide helpful tips that frontline staff can use when engaging in talking about consent with program participants. This video will define key concepts such as coordinated access, HIFIS, consent options on the consent form, HIFIS consent types, as well as outline the consent process and supporting documents that are available to ensure consistent and transparent communication with program participants across the coordinated access system. After this training, you should feel equipped with the tools and information you need to confidently review the HIFIS and Coordinated Access Client Consent Form with program participants. As a service provider, it's important to support informed client consent by ensuring people understand how their information is collected, used, and shared, as well as what kind of information is collected and what choices are available to them when they sign the form. In the first part of this video, we will introduce key concepts from the consent form. Let's look at the HIFIS and Coordinated Access Client Consent Form. On the form, you will notice two overarching themes, HIFIS and Coordinated Access. It is important to understand both when talking about consent with a program participant. Coordinated access is a way for communities to bring consistency, equity, and efficiency to the process by which people experiencing or at risk of homelessness access services and housing-related resources. Coordinated access systems are flexible based on community needs. However, all coordinated access systems must meet the minimum requirements set out by Reach and Home. This includes HIFIS and a coordinated access list, as mentioned in the consent form. Coordinated access is a system in which multiple agencies collaborate to support individuals in accessing housing and related services. The Homelessness Individuals and Families Information System, also known as HIFIS, is a secure database used nationally to record and store information that can help support program participants' housing and service needs. Information entered into HIFIS is used by communities to support the coordinated access system, identify trends and barriers, and understand the needs of the unhoused population. Client information in HIFIS includes basic demographics and other relevant details to support housing and service delivery. HIFIS does not track medical or legal information unless it affects access to housing. For example, a medical need for an accessible unit. The information entered into HIFIS is used to generate a coordinated access list, also referred to as the by name list. Priority lists are derived from the coordinated access list and are used as a tool in matching and referral processes. This means that information entered is important and can impact an individual's ability to be matched to a housing resource. Consent is required by program participants before information is entered into HIFIS and shared with agencies that participate in coordinated access. Details about how information is shared will be explained later in the video when going over consent options. For now, it's important to know that client information is only shared with agencies that participate in the coordinated access system unless the program participant explicitly consents. Information to law enforcement entities is only required where there is a warrant. Even in those situations, the authorities should be redirected to the Human Development Council. If you are unsure, it is always best to contact your organization's management or inform the officers to come back when management is present. Aggregate data may be used for research, program planning, or advocacy. Aggregate means the information is grouped with similar data, is non-identifiable, and cannot be traced back to a participant. One of the most important parts of informed consent and this consent form is that consent is always voluntary. If a program participant chooses not to give consent, it will not limit their access to emergency services, such as street outreach, emergency shelters, or drop ins. However, without consent, clients cannot be referred to housing resources or services that are dedicated to the coordinated access system. Service providers can still progressively engage with participants to explore housing options and address housing-related barriers in an appropriate capacity outside of the coordinated access system. Consent can be provided and withdrawn at any time during a program participant's journey to housing. It is important to note that withdrawal is not retroactive. Information and data added to the participant's file cannot be entirely removed. The participant's name will remain visible, but the file will be inaccessible to service providers until a new consent is uploaded. As mentioned earlier in this video, program participants have options when consenting and completing the HIFIS and Coordinated Access Client Consent Form. Let's take a closer look at the consent options on the form. On the HIFIS and Coordinated Access Client Consent Form, there are three options for a program participant to provide consent. A service provider can explain these options to the program participant and help answer any questions the participant may have. Let's start with option 1. How do these consent options relate to the options available on HIFIS when creating or updating a client file? There are three types of HIFIS consent records that correspond to the options on the consent form. First, coordinated access plus explicit. This is selected when a participant chooses the first option on the form. This allows them to be added to HIFIS, visible to coordinated access providers, and included on the coordinated access list. Second, explicit. This is selected when a participant chooses the second option. This allows them to be added to HIFIS and visible to coordinated access providers, but not included on the coordinated access list. Third, decline to share. Selected when a participant chooses the third option. This allows them to be added to HIFIS, but visible only to the service provider completing the form. As noted, only participants with a coordinated access plus explicit consent record in HIFIS can appear on the coordinated access list. Participants have the right to change their consent decision at any time. For assistance, please contact HIFIS support. Now, let's talk about verbal consent. In some cases, verbal consent is allowed when a participant cannot physically access a service provider or has an impairment that prevents them from signing the form. If consent is given verbally, this must be recorded on the form by selecting the checkbox. Staff must explain the consent form and its implications for HIFIS and coordinated access. Participants should be informed that they will need to sign the form at their first in-person meeting. Now it's time to end the consent process. Once the participant has made their consent decision, the form must be signed by the participant and a witness who was present. For a consent form to be valid, it must include the client's name, date of birth, signature, and the date signed. It must also include the witness's name, signature, agency, and date in the designated area. The witness must be a staff member from a coordinated access participating service provider. It is important to make sure that the written information is legible. Once the consent process with the participant is complete, please upload the signed HIFIS and Coordinated Access Client Consent Form in the Consent module on HIFIS, selecting the consent option that reflects the client's preferences for information sharing. If you need assistance with uploading consent onto HIFIS, please refer to User Flow for step-by-step guidance. It includes instructions for both client profile creation and updating consent for existing clients. If you need help accessing User Flow, contact your management team or your organization's designated SUE representative. In the next section, you will learn about supporting documents for the consent process that were developed by the Human Development Council, including what each of these documents are and how and when they can be used in practice. The supporting documents include HIFIS and Coordinated Access Consent Policy, Coordinated Access Consent Work Aid, HIFIS and Coordinated Access Client Consent FAQ, HIFIS and Coordinated Access Verbal Consent Policy, and Coordinated Access Participating Organizations. Next, we will review the supporting documents available to guide staff through the consent process. First, the Coordinated Access Consent Policy provides guidance for service providers working with clients in HIFIS and coordinated access. It includes detailed information on how to obtain consent, the different consent types, and how to manage renewing, withdrawing, or declining consent, as well as client information requests and data entry in HIFIS. Next is the Coordinated Access Consent Work Aid. This tool supports frontline staff by outlining clear steps to follow when completing consent-related activities, such as when a client provides, withdraws, or declines consent. We will now look at the HIFIS and Coordinated Access Client Consent FAQ. This document answers common questions clients may have, helping staff provide clear and consistent information while supporting transparency and confidence. Another document is the HIFIS and Coordinated Access Verbal Consent Policy. This outlines what verbal consent is, when it can be used, and how it should be properly documented. Lastly is a list of coordinated access participating organizations. This can be shared with clients when they ask which agencies are involved or as a part of the consent process. The HIFIS and Coordinated Access Client Consent Form and supporting documents can be found on the Human Development Council's website. You can also reach out to your community's Coordinated Access Facilitator to access these documents or ask any questions. Thank you for taking the time to watch this training video and for your commitment to supporting informed consent practices.